Okay, folks, welcome to another deep dive. This one's a doozy.
Yeah.
So you guys sent in some articles about Dr. Oz,
Dr. Oz.
the TV doctor.
Right, right.
And it looks like President-elect Trump nominated him to run CMS,
Oh, wow.
the Centers for Medicare and Medicaid Services.
Yeah, that's a big one.
Big one, right?
Yeah.
So we're going to unpack what this means for, well, everybody's health care.
For 160 million Americans.
Yeah, 160 million Americans.
That's a lot of people.
That's a lot of people. So I guess first off, this is a pretty big career jump.
I mean, yeah, from TV doctor
TV doctor.
to senator.
Senator.
Right, almost senator.
Almost senator.
Almost.
Lost the race in Pennsylvania.
To John Fetterman.
Right, to John Fetterman. And now he's going to be in charge of CMS.
Potentially.
Yeah.
It's a big agency.
So what is Trump's reasoning here? I mean, why does he think Dr. Oz is the guy for this job?
Well, Trump said something like, make America healthy again.
Oh, he's bringing that back, huh?
Which is, yeah, a little ironic considering he once called Oz a healthy specimen himself.
Right. Like you're the picture of health.
Yeah.
So tell me a little bit more about CMS. What exactly does this agency do?
So CMS basically oversees all the major healthcare programs for over 160 million Americans.
Right.
You're talking Medicare, Medicaid, the Children's Health Insurance Program,
Wow.
and even the Affordable Care Act's health insurance marketplace.
In marketplace.
All of that falls under CMS.
So that's a lot of responsibility.
Massive responsibility.
I mean, we're talking my grandma's prescriptions,
Right.
my neighbor's kids' asthma treatments.
Yeah.
All of that's tied to this agency.
Pretty much, yeah.
Right.
I mean, if you're on any kind of government healthcare program,
Yeah.
CMS is involved somehow.
So how do Oz's, medical endorsements play into all this?
Well, that's where things get a little dicey.
Yeah, I was just thinking about that.
You know, Oz has a bit of a history promoting some unconventional treatments, things that maybe aren't exactly backed up by, the mainstream medical community.
Yeah, like that whole hydroxychloroquine thing.
Yeah. The hydroxychloroquine for COVID, that was a big one.
A lot of people were talking about that.
And a lot of medical professionals were kind of scratching their heads like,
Really?
is this really the way to go?
But so how does that kind of stuff affect his potential role at CMS?
Well, that's the million-dollar question, right? I mean, if he's willing to endorse something like hydroxychloroquine,
Yeah.
despite what a lot of experts were saying, what does that say about his approach to other treatments?
Right.
What's he going to do about vaccines? What about other COVID treatments?
Does this mean he's going to push for certain treatments to be covered by Medicare and Medicaid, even if they're controversial?
It's possible. It's definitely something to keep an eye on.
And it wasn't just hydroxychloroquine, right?
Oh, no, there are other things.
There was the weight loss plan.
Oh, yeah, the pregnancy hormone.
The pregnancy hormone and 500-calorie diet combo.
Yeah, that one raised a lot of eyebrows, too.
I mean, 500 calories a day, that's
That's not healthy.
not a lot.
For most people, at least.
So that's a little concerning.
Yeah, I mean, if someone's promoting that kind of extreme diet, what does that say about their overall approach to health and wellness?
Right.
And what does it mean for CMS programs related to obesity and weight management?
Yeah, makes you wonder.
Are they going to be based on sound science, or are they going to be influenced by these kind of fads?
Right. So we've got a TD doctor who's promoted some questionable treatments.
Yep.
And he's coming off a failed Senate run against John Fetterman.
Right.
And now he might be in charge of health care for millions of Americans.
It's a lot to process.
What did Fetterman have to say about all this?
Well, Fetterman actually released a statement.
Oh, he did?
Yeah, and he basically said, he's not really interested in, settling political scores.
Right.
He's more concerned with protecting Medicare and Medicaid.
Yep.
Making sure those programs are there for the people who need them.
So he's putting the needs of the people first.
That seems to be his message. Yeah.
Okay, I like that.
Okay.
All right, so we've talked about, Oz's medical background,
Sure.
his Senate race,
Yeah.
his endorsements.
Yeah.
We haven't really touched on his relationship with Trump.
That's another interesting layer to this whole thing.
Right. I mean, Trump was a big supporter of Oz during the Senate race.
Oh, yeah. Big supporter.
Even said that Oz gave him like a clean bill of health.
Yeah, which, kind of adds another layer of complexity to this whole nomination thing.
So there's obviously some political dynamics at play here.
Definitely.
But beyond the politics, there's one issue that I think is really important to a lot of people.
Abortion.
Abortion.
Yeah.
What's Oz's stance on that?
Well, during the Senate campaign, Oz said he believes the decision should be left up to the states.
Okay, so he's pro-choice.
It's not quite that simple. I mean, he didn't explicitly say he was pro-choice.
Right.
But saying it should be left up to the states, that's generally interpreted as being in favor of allowing states to decide whether or not to allow abortion.
Okay, so how might that affect healthcare policy, especially for women who rely on Medicaid?
That's a big question.
Yeah.
I mean, if Roe v. Wade is overturned
Right.
and states start banning abortion, will women on Medicaid still be able to access abortion care?
That's a really good question.
It's something that a lot of people are worried about.
Yeah, and it's something that we're going to have to wait and see how it plays out.
Exactly.
So this deep dive has been a lot to take in.
It's a lot.
We've covered Dr. Oz's background, his endorsements, his Senate race, his relationship with Trump,
Yeah, we've covered it all.
and, of course, the potential implications of his nomination for CMS.
It's a big deal.
A big deal. And we want to thank you for sending in those articles.
Yeah, thanks for keeping us informed.
This is really important stuff, and we appreciate you bringing it to our attention.
And it leaves us all with a big question, right?
Yeah.
What does this all mean for the future of healthcare in America,
Yeah.
especially for those who rely on programs like Medicare and Medicaid?
It's a question we all need to be thinking about.
Absolutely.
All right, folks, thanks for joining us for another deep dive.
We'll see you next time.
See you next time.